So this is the secondary trauma survey. During this, we're going to also utilize our standard precautions and apply the appropriate PPE. First, we're going to repeat the vital signs such as pulse, respirate, blood pressure, SpO2, temperature, BGL, and perform an ECG if necessary. So the purpose of this is to identify any potential injuries such as DCAT, BLS tick during the secondary survey. So we'll have them in a comfortable position, and we begin by inspecting and palpating the scalp and ears and checking for any CSF. We're also looking for any raccoon eyes around the eyes or battle signs behind the ears. We're palpating the facial area, just checking for any weakness or pain. Moving down to the neck, we're checking for tracheal deviation, JVD, and we're palpating the cervical spine, just checking there's no DCAT BLS tick there. Moving on to the chest, we have to inspect it first before touching. We're looking for any movement that isn't normal and looking for accessory muscle use. We're going to palpate the chest on both sides, looking for any subcut emphysema or instability or crepitation. We'll move on to auscultation of the chest. In the 4 quadrants, we're looking for any crackles, wheezing, or noisy breathing. Can't detect anything abnormal there. We'll also check the heart sounds. Not diminished at all, so that's a good sign. We can percuss the chest as well, just checking for hyperresonance or if it's dull, so we can consider a pneumothorax. Moving down to the abdomen, we're inspecting before palpation. We're just seeing if there's any tenderness or rigidity here, seeing if there's any pain in the 4 quadrants. We'll move down and inspect the pelvis. We're palpating, checking for any instability that we found on the primary survey. Here we can also verbalize anything we find about the genitalia, such as incontinence or priapism, neither of which are present here. We also inspect the extremities, looking for any injuries or marks. We're also assessing the circulation and motor function on both arms and legs on both sides. So again, grip strength and pushing against the palm of my hand, and if they have sensation in their hands and feet. Here we can reassess disability, so the GCS, which is again normal. Checking the pupils again, Pearl again, and after this is where we manage any injuries we might have found and keep performing an ongoing assessment before making a transport decision.